Heart attacks are often perceived as sudden and unpredictable events. But in reality, most heart attacks develop over many years as a result of gradual damage to the coronary arteries, the blood vessels responsible for supplying oxygen-rich blood to the heart muscle. And understanding the major risk factors that contribute to this damage is one of the most powerful tools we have in preventing cardiovascular disease, because when individuals recognize these risks early, they can take meaningful steps to reduce them and significantly improve long-term heart health. And while modern medicine has made remarkable advances in treating heart attacks once they occur, prevention remains the most effective strategy, which is why it is essential to understand the 5 key risk factors that most strongly contribute to heart attacks around the world. The first major risk factor is high blood pressure, also known as hypertension, a condition that affects millions of people and is often called the silent killer, because it frequently develops without obvious symptoms while gradually damaging blood vessels over time. When blood pressure remains elevated for long periods, it places continuous stress on the arterial walls, causing them to become thicker, less flexible, and more prone to the development of atherosclerosis, the process in which fatty deposits known as plaques accumulate inside the arteries, narrowing the blood vessels and restricting blood flow to the heart. And when one of these plaques ruptures, it can trigger the formation of a blood clot that suddenly blocks the artery and causes a heart attack, which is why monitoring and controlling blood pressure through lifestyle changes, regular medical checkups, and appropriate medications when necessary is one of the most important steps individuals can take to protect their cardiovascular system. The second major risk factor is high cholesterol, particularly elevated levels of low-density lipoprotein cholesterol, often referred to as LDL cholesterol or bad cholesterol, which plays a central role in the development of plaque within the coronary arteries. Cholesterol itself is a natural substance produced by the body and also obtained from certain foods, and while it serves important biological functions, excessive LDL cholesterol circulating in the bloodstream can penetrate the inner lining of the arteries and gradually accumulate over time, forming fatty deposits that narrow the blood vessels and reduce the amount of oxygen reaching the heart muscle. And this process can occur silently for many years before symptoms appear, making regular cholesterol screening and adopting heart-healthy dietary habits essential components of cardiovascular prevention. Another critically important risk factor for heart attacks is diabetes, a metabolic condition characterized by elevated blood sugar levels that can damage blood vessels and nerves throughout the body, including those that control the heart and circulatory system. When blood glucose levels remain chronically elevated, they contribute to inflammation and oxidative stress within the arteries, accelerating the process of atherosclerosis and significantly increasing the likelihood of coronary artery disease. And individuals with diabetes often have additional cardiovascular risk factors such as high blood pressure, abnormal cholesterol levels, and obesity, which together create a combination that substantially increases the risk of heart attack compared to individuals without diabetes, making careful blood sugar control, lifestyle management, and regular medical monitoring essential for reducing cardiovascular complications. The fourth key risk factor for heart attacks is smoking, a habit that has profound and harmful effects on nearly every part of the cardiovascular system. Cigarette smoke contains thousands of chemicals including nicotine and carbon monoxide that damage the inner lining of the arteries, promote inflammation, increase blood clotting tendency, and reduce the amount of oxygen available to the heart muscle. And over time, smoking accelerates the progression of coronary artery disease while also increasing the likelihood that a plaque within the artery will rupture and trigger a sudden blockage, which is why smoking cessation is one of the most powerful and immediate steps individuals can take to reduce their risk of heart attack. And the benefits of quitting smoking begin within weeks as circulation improves and the body gradually begins to repair the damage caused by tobacco exposure. The fifth major risk factor is an unhealthy lifestyle characterized by poor diet, physical inactivity, chronic stress, and excess body weight. Because modern lifestyles often involve long hours of sedentary behavior, high consumption of processed foods rich in salt, sugar, and unhealthy fats, and limited opportunities for regular physical activity, all of which contribute to the development of conditions such as obesity, hypertension, and abnormal cholesterol levels that significantly increase the risk of cardiovascular disease, and maintaining a heart-healthy lifestyle requires conscious effort and consistent habits such as consuming a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, engaging in regular physical activity such as walking, cycling, or swimming, managing stress through relaxation techniques and healthy coping strategies, and ensuring adequate sleep and recovery. And while these 5 risk factors represent some of the most significant contributors to heart attack risk, it is also important to recognize that certain non-modifiable factors such as age, gender, and family history can influence an individual's susceptibility to heart disease, because genetic predisposition can affect how the body processes cholesterol, regulates blood pressure, or responds to metabolic stress. However, even when genetic risk is present, adopting healthy lifestyle habits and maintaining regular medical care can dramatically reduce the overall likelihood of developing serious cardiovascular complications. And this highlights an important principle in preventive cardiology, which is that while we cannot control every aspect of our biology, we can control many of the behaviors and habits that influence long-term heart health. And by addressing the major modifiable risk factors such as blood pressure, cholesterol, blood sugar, smoking, and lifestyle habits, individuals can significantly lower their risk of heart attack and improve their overall quality of life. And this process begins with awareness and education, because when people understand how these risk factors affect the heart, they are more likely to take proactive steps to monitor their health, seek medical advice when needed, and make gradual but meaningful lifestyle changes that support cardiovascular well-being, ultimately reminding us that protecting the heart is not the result of a single decision but rather a continuous commitment to healthy living, regular monitoring, and early intervention whenever risk factors begin to appear.